Coronaviruses are a large family of viruses which may cause illness in animals or humans. In humans, several coronaviruses are known to cause respiratory infections ranging from the common cold to more severe diseases such as Middle East Respiratory Syndrome (MERS) and Severe Acute Respiratory Syndrome (SARS). The most recently discovered coronavirus causes coronavirus disease COVID-19. Public health experts around the globe are scrambling to understand, track, and contain a new virus that appeared in Wuhan, China, at the beginning of December 2019. The World Health Organization named the disease caused by the virus COVID-19, which references the type of virus and the year it emerged. The most common symptoms of COVID-19 are fever, tiredness, and dry cough. Some patients may have aches and pains, nasal congestion, runny nose, sore throat or diarrhea. These symptoms are usually mild and begin gradually. Some people become infected but don't develop any symptoms and don't feel unwell. Most people, about 80%, recover from the disease without needing special treatment. Around 1 out of every 6 people who get COVID-19 becomes seriously ill and develops difficulty breathing. Older people, and those with underlying medical problems like high blood pressure, heart problems or diabetes, are more likely to develop serious illness. About 2% of people with the disease have died. People with fever, cough and difficulty breathing should seek medical attention. People can catch coronavirus from others who have the virus. The disease can spread from person to person through small droplets from the nose or mouth which are spread when a person with coronavirus coughs or exhales. These droplets land on objects and surfaces around the person. Other people then catch coronavirus by touching these objects or surfaces, then touching their eyes, nose or mouth. People can also catch coronavirus if they breathe in droplets from a person with coronavirus who coughs out or exhales droplets. This is why it is important to stay more than 1 meter away from a person who is sick. Can the virus that causes coronavirus be transmitted through the air? Studies to date suggest that the virus that causes coronavirus is mainly transmitted through contact with respiratory droplets rather than through the air. The main way the disease spreads is through respiratory droplets expelled by someone who is coughing. The risk of catching virus from someone with no symptoms at all is very low. However, many people with virus experience only mild symptoms. This is particularly true at the early stages of the disease. It is therefore possible to catch virus from someone who has, for example, just a mild cough and does not feel ill. Protection measures for everyone. Virus is still affecting mostly people in China with some outbreaks in other countries. Most people who become infected experience mild illness and recover, but it can be more severe for others. Take care of your health and protect others by doing the following. Regularly and thoroughly clean your hands with an alcohol-based hand rub or wash them with soap and water. Because washing your hands with soap and water or using alcohol-based hand rub kills viruses that may be on your hands. Maintain at least 1 meter distance between yourself and anyone who is coughing or sneezing. As when someone coughs or sneezes they spray small liquid droplets from their nose or mouth which may contain virus. If you are too close, you can breathe in the droplets. Avoid touching eyes, nose and mouth, as hands touch many surfaces and can pick up viruses. Once contaminated, hands can transfer the virus to your eyes, nose or mouth. From there, the virus can enter your body and can make you sick. Make sure you follow good respiratory hygiene. This means covering your mouth and nose with your bent elbow or tissue when you cough or sneeze. Then dispose of the used tissue immediately. Stay home if you feel unwell. If you have a fever, cough and difficulty breathing, seek medical attention and call in advance. Stay informed on the latest developments about coronavirus. Follow advice given by your healthcare provider, your national and local public health authority or your employer on how to protect yourself and others from virus. The risk depends on where you live or where you have traveled recently. The risk of infection is higher in areas where a number of people have been diagnosed with coronavirus. More than 95% of all virus cases are occurring in China, with the majority of those in Hubei province. For people in most other parts of the world, your risk of getting virus is currently low. However, it's important to be aware of the situation and preparedness efforts in your area. No, antibiotics do not work against viruses, they only work on bacterial infections. Coronavirus caused by a virus, so antibiotics do not work. Antibiotics should not be used as a means of prevention or treatment of coronavirus. They should only be used as directed by a physician to treat a bacterial infection. There is no vaccine and no specific antiviral medicine to prevent or treat coronavirus. However, those affected should receive care to relieve symptoms. People with serious illness should be hospitalized. Most patients recover thanks to supportive care. Possible vaccines and some specific drug treatments are under investigation. They are being tested through clinical trials. WHO is coordinating efforts to develop vaccines and medicines to prevent and treat virus. The most effective ways to protect yourself and others against coronavirus are to frequently clean your hands, cover your cough with the bend of elbow or tissue, and maintain a distance of at least 1 meter from people who are coughing or sneezing. A mask should only be used by health workers, caretakers, and individuals with respiratory symptoms, such as fever and cough. Before touching the mask, clean hands with an alcohol-based hand rub or soap and water. Take the mask and inspect it for tears or holes. Orient which side is the top side. Ensure the proper side of the mask faces outwards. Place the mask to your face. Pinch the metal strip or stiff edge of the mask so it molds to the shape of your nose. Pull down the mask's bottom so it covers your mouth and your chin. After use, take off the mask, remove the elastic loops from behind the ears while keeping the mask away from your face and clothes, to avoid touching potentially contaminated surfaces of the mask. Discard the mask in a closed bin immediately after use. Perform hand hygiene after touching or discarding the mask. Use alcohol-based hand rub or, if visibly soiled, wash your hands with soap and water. As of the 1st of March, the outbreak has affected an estimated 87,000 people globally. In mainland China there have been over 2,600 deaths among over 78,000 cases, mostly in the central province of Hubei. More than 12,000 people affected in China have already recovered. The coronavirus has spread to at least 30 other countries. The most badly affected include Japan, with 850 cases, including 691 from a cruise ship docked in Yokohama, and 4 deaths. Italy has recorded at least 1,100 cases and 29 deaths, while South Korea has recorded more than 3,500 cases and 8 deaths. There have also been deaths in Hong Kong, Taiwan, France, the US and the Philippines. There have been 15 recorded cases and no fatalities to date in the UK. The coronavirus spreading in China and the SARS outbreak of 2003 have two things in common: both are from the coronavirus family and both were passed from animals to humans in a wet market. Coronaviruses are zoonotic diseases, meaning they spread to people from animals. Because wet markets put people and live and dead animals in close contact, it can be easy for a virus to make an interspecies jump. Scientists are racing to identify the source of the coronavirus that is causing havoc around the world. 3 weeks ago, Chinese scientists suggested on the basis of genetic analyses that the scaly ant-eating pangolin was the prime suspect. But scientists have now examined those data along with 3 other pangolin coronavirus studies and say that although the animal is still a contender, but the mystery is still far from being solved and research is being done for this. Conclusion from coronavirus is that everyone should take proper safety measures to prevent this virus. Consult a doctor if you are sick from a few days. Avoid close contacts with others and stay healthy and fit.